Hi guys, this is Dr. V again from Mayfair Animal Hospital. I am going to do a video today on how to brush your dog's teeth and at-home dental care in general. So a lot of the things that you want to kind of keep an eye out for when you're thinking your dog might have some dental disease is, does their breath stink? Are they having more issues with eating? Are they starting to get swellings on their face? Because sometimes that can mean that we have an abscess that's because of dental disease. So a lot of people kind of neglect looking at their dog's teeth. They don't think about the fact that brushing their teeth is just as important as brushing our teeth, because the tartar that we get is the same thing that they get, and it builds up. And a lot of times if it goes untreated or unnoticed, the big implications are that we're going to have some systemic issues. Mostly we're thinking the heart is going to start to be affected, and other organs can also be affected because the tartar will lead to bacteria traveling throughout the body. So big things that we can do at home. The best one is to brush your dog's teeth. I will say that I am very bad at this, and it's not something that I do regularly with Tegan. So she does have some tartar buildup even though she got a dental cleaning last year. So that is something that I'm going to start to focus on with her. Other things that we can do at home, if you know that brushing isn't going to be something that your dog will tolerate, is going to be things like there are dental treats. So some of the big brands that I can think of are Greenies. They have enzymes in them. The enzymes in these treats can break down tartar. There are also rawhides that have enzymes in them. Other brands, one of them is called Oravet. It's a nice big chewy treat. Those treats only really work if your dog chews them. If they take one bite and swallow them whole, they don't really do anything for your dog's teeth. Other options for at-home care include a water additive that also has enzymes in them. Again, this water additive, it's just a splash of it in the water. If your dog won't drink the water because of the additive, then that's going to be a con to this. Another thing is obviously it only works for as long as the additive is contacting the teeth. So brushing is going to be the best way to get that tartar off of your dog's teeth. Sometimes if the disease is bad enough, we're going to want to get in there under anesthesia, do a dental cleaning, and potentially extract some teeth that are loose. So that is something that we can definitely discuss at your appointment. But other than that, we will get started on how I would go about brushing your dog's teeth. So Tegan is again laying down for us today. So I'm just gonna kind of lift up her lip and show you guys. So she's missing the upper canine there, but this is the big grinding tooth of the dog, and that's the one that they utilize a lot. That's also the one that gets most of the tartar buildup. She has a little bit of inflammation of those gums. If you can see, it's kind of raised and a little bit reddened, so that means we're having some gingivitis or gum inflammation. These teeth are also getting some tartar buildup. If we can look at the other side of her mouth. So again, that big upper fourth premolar is the one that they utilize the most, and that's the one that has the most tartar buildup. I see a lot of tartar buildup on these teeth. I see a lot of gum recession, so the gum will start to lift away from the tooth, and then we start to get some root exposure. That is when we're going to be most concerned with a tooth root abscess, because that gum protects the tooth from getting bacteria under the gum line. So when we are looking into getting a toothbrush for a dog, we don't want to use human toothpaste. It has fluoride in it, and fluoride is not good for dogs. So I usually go for a kit. It's a kit that includes a toothpaste that has enzymes in it. So again, those enzymes help to break down the bacteria. This kit specifically has a toothbrush that has two ends, one for bigger dogs and one for smaller dogs. And then it also has a finger toothbrush. So I'm going to use the big end of my toothbrush and then the finger toothbrush to kind of show you two different ways that you can go about it. With Tegan, she really likes the toothpaste because it's flavored, it's chicken flavored, so it helps to kind of entice her to allow me to do the toothbrushing. So I will start with that. Hi, Mama. Oh, are you ready? What's this? You want a treat? Are you a good girl? Okay, baby. Let me see. Good job, Mama. Making a little mess. All right, so I really like to target, like I said, that upper fourth premolar. So that one I'm just kind of getting in there and scrubbing. If you use a dry toothbrush, that works just as well, but sometimes they're not gonna be as apt to let you get in there. So I know, baby, you good girl. Yeah. And sometimes the gums will bleed depending on how intense the disease is. So if that happens, sometimes again, a dental cleaning is gonna be our best bet. I know, baby, I'm drooling. Good girl. Yeah. Yeah, I made a mess of your face, huh? Yeah. Good girl. No mess? Good girl. Good job, baby. And then on the other side, I will use the finger toothbrush. So same concept, it's just a little bit smaller and sometimes works better for a smaller mouth. I'm gonna reapply my toothpaste because I'm using it on the other side, so I wanna get some contact time with that side of the mouth too. And the premolars and the canines tend to be the areas where we have the most concern. So I'm just gonna get right on there with that canine and kind of scrub right at the gum line. So the gum line tends to be the area where they get the most disease. So just scrubbing as much as I can, and obviously as much as they'll allow you to do. When they kind of reach a limit, that's gonna be it for that day. Ideally, you are gonna brush their teeth daily. A lot of times, I would say 3 times a week is the least you want to brush the teeth, because that's gonna get you the most rewarding progress on that disease that we have in the mouth. And you can see kind of that gum is starting to bleed a little bit. The finger toothbrush is a little bit more rough, so sometimes if you're just starting out, you might want to go with the bristled toothbrush instead of the finger toothbrush, but I'm just gonna scrub her up a little bit more and then I'm gonna call it a day. So a lot of times the upper arcade of the mouth is going to be the one that you can actually get to. The lower arcade is a little bit more difficult. If you wanted to try to open up their mouth, you could, but a lot of times the upper teeth are the ones that we see the most disease on. So that is how I go about brushing a dog's mouth. Other than that, brushing their mouth, brushing their teeth. Other than that, I don't really have anything else on dental disease.